up. Welcome. All right. Hello.
Go ahead, sorry.
I'm Desti Holman-Sprague with the Maine Coalition Against Sexual Assault.
And I'm Casey Benner from the Maine Statistical Analysis Center, located at the University of Southern Maine in Portland. And so we did our collaboration through the Maine SAC and VOCA-SAC, which is kind of overseeing and housing all kinds of amazing data for 7 different sexual assault centers in Maine. And we were intending to, or the purpose of this collaboration was to look at and mine their data because they didn't have the internal time and capacity to mine their data. And it's a vast amount of data, and so this collaboration gave us an opportunity to help look into it with them. Am I pressing the wrong one? Oh.
Okay, she did tell us that.
Yeah.
So VOCA-SAC is our state sexual assault coalition. In Maine, we do not do what we call dual service provision. We have standalone sexual assault services that are separate from standalone domestic violence services. So both the coalitions are separated and all of the service providers at the local level are separated. Which feels like important context. And VOCA-SAC is the funder of local sexual assault services, and also we're quite a robust coalition. When we think about coalitions nationally, we do, because we are a very small state with a very small population of 1.3 million, one of the ways, and then because sexual assault services as standalones were quite small, one of the ways that we've ensured sexual assault services are effective with limited resources for a small population is to have a really kind of robust coalition where we do lots and lots of work for, with, and on behalf of the local service providers. Everything from, hosting their websites to managing all of their data processes. So, yep, and there they are.
Yeah. I wanted to switch pages while you're talking about them, Desti, because this is just a look at the 7 different locations of where this data is being collected that we looked at, and what VOCA-SAC is helping get done in Maine. And there's one service provider in this list that will show up differently on the rest of the slides because they have 2 names, it's not officially a name change yet. And so the Immigrant Resource Center of Maine is also known as the United Somali Women of Maine, and they are located in Lewiston, and they are not limited to a geographical area the way the rest of the sexual assault centers help divide up their resources. And so I just wanted to point that out in case, as we go forward, someone notices that IRCM is no longer on any of the slides.
They're still there.
They are still there. They're just going to be USWOM on the rest of the slides because that's how they are in the data.
Every county in Maine is served by a independent full-service sexual assault support center that provides a wide range of services, including support groups, drop-in groups, outreach, helpline, 24-hour helpline, etc. So because we have dedicated service providers for every county, we have quite a good reach within those services. So.
And just a quick note about the Maine Statistical Analysis Center is that it's housed within a bunch of different programs. So we are located at the Cutler Institute of Health and Social Policy that is at the University of Southern Maine's Portland location. And that is housed within the Muskie School of Public Services. And so there are a ton of different research projects going on for the Maine SAC that are related to justice policy, to the children, youth, and families, disability and aging, and population health and health policy, and there's also my other project there, which is the Violence Against Women Act Measuring Effectiveness Initiative. Actually, may have spoken to some of you before about discretionary grants or staff for soft grants, because we collect that data and then report on it back to OVW. And so one of the other amazing things about the SAC is that they are reaching out to Maine community. All these different researchers are reaching a bunch of different priority areas. And so this collaboration is really helpful because we are already in the works of collaborating on multiple other projects now.
To skip ahead to one of the findings, this collaboration has been great for us because, having the VOCA Measuring Effective Initiative in our state has always been sort of interesting because we know those people. It's a small state. You know everyone, but we weren't working together with this sort of national TA provider in very meaningful or intentional ways. And I think that in the last year, since we started talking about this, that has really changed dramatically and has been awesome. So a little bit about where this data is coming from. So we're the possible outlier victim services provider that is deeply invested in data collection. And I've been there for 10 years, and so that's a long time to try to build, and I love data a lot, and so it's a long time to kind of build systems. And so we launched a statewide database with sexual assault service providers in 2015. So we're now, 3 years into this system, and all of the local providers have their own independent database. So I, as the person overseeing this, can't go in and tinker with their system, but they upload 100% of their data to me on a monthly basis. And it's a really wide array of stuff, everything from demographics. Every client gets a unique identifier, and so their demographics, their own history of victimization. You can do profiles of victimization types. So, for instance, if there was a victimization when they were 6 and, the offender was the neighbor, and whether they reported, you have that as a unique bundle of information. And then if that individual client also had a victimization when they were 16 and it was a, intimate partner, then you can track those bundles of information. So there's a ton in there. However, one of the things that we did not plan for very well when we launched this database was that I would not have a lot of capacity to just sort of explore the data. So we set up the system to collect it all, but we didn't set up great systems for then what? And so this is the then what.
So that was a really great overview. So for the then what, we decided to look at all of the data from January 2016 through December of 2017 because when we were talking to DESTI about this data, it was launched separately at each of the locations after they received training. So it wasn't launched all on the same day. And so the data from October 15th to the end of 2015 was not going to be a good reflection of what every agency was doing. So we chose a different starting point to look at for that reason. And then, so we downloaded all of the data from those 2 time periods for all 7 agencies that were uploading data to DESTI. And from there, the data that downloads from EmpowerDB downloads into bundle, kind of like what DESTI was just saying, where you could download the data based on the service date, the incident date, and the referral date. And so it would all have information about the same clients, but maybe less information would be downloaded because not every client had an incident date reported or a referral date reported. And so once we downloaded all of those data chunks, we combined it in SPSS and Excel to check for duplication and check for like practice records, and we took out any of the records that were like fake practice clients for new users to get into the database with. And then we also took out any collateral contacts because the database was initially being used to also track collateral contacts, which were not contacts with victims. And so any of the data in those client records wasn't reflective of a victim's client record. And so there was a lot of like parsing out like which records do we want to include in this final analysis. And so just as a quick overview, we separated out what client records were being housed by which agencies, and then from there we also noticed that there was a small chunk of records that were not assigned to an agency, so they don't get included in agency-level data. And that really just comes down to, like, because it's a new database and all the users were new, it's not a perfect system right off the start, and that's what is expected. And so we also got to see, once we broke down into agency-level data, we could then see what underserved demographics were being served by each agency, any gaps in reporting. So it was really helpful to be able to separate them down this way also, because as you saw from that map, all of the different agencies are serving a different chunk of Maine.
One thing I would also just note in terms of setting up a really comprehensive database like system like this, that we were also underprepared for how much capacity it would take to get the local service providers, like using all the same definitions. We have a really comprehensive manual, but if I were to do it again, I would have, tripled or quadrupled the amount of time I expected to spend with them, ensuring that they were really using it well and accurately and doing a lot more back-end checks in that early phase. And this data, to me, is really reflective of all the ways that the system was just still being implemented. And even 3 years on continues to be, we're still improving our system. And can talk a bit about that later on.
So this is, again, just a quick look at some underserved variables, and I like this graphic just because it shows you that intersectionality of all the different underserved variables that we got to explore here. So there was things like physical disability, cognitive disability, if the client lived in a rural place, if they identified as LGBTQ. We looked at the different primary race categories. We separated out all the age cohorts, and created cohorts of age variables based on date of birth. There was if they were limited English proficiency in there, if they were marked as deaf or hard of hearing. There was also some agencies collecting data on if their clients were college students. And so there's just a wide variety of underserved demographics that we could explore here, which was really impressive. And then just some examples of the kinds of analyses we were doing. We looked at things such as like if the client, like what the intersection of a client's race and gender was with the service type that they were receiving. The number of times a client accessed a service. So some services or some client records may have had up to 8 different services reported on them, while some other, like if you looked at male client records, the most services that any of those client records had was 5. And so we were able to really start breaking down and like just doing quick comparisons of the different underserved demographics to see if there was any differences in what services they were accessing, what referral sources there were for each of these different clients. And so another interesting one we were able to do was looking at age cohorts to see if certain legal action was taken. So as would be expected, if it was an underage kiddo, the chances or percentage of those client records that had a legal action taken or if it was reported to police was really, really high, whereas if you were looking at older age demographics, it was really, really low. And so just doing all of these different comparisons, I only listed a few here, and I didn't put a lot of them on the slides because it's a lot of data, and I didn't know that, I wasn't sure what kind of audience we would have today as far as who's as interested in data as me. So, and so just another note off of all of those different demographics we looked at was that there was a lot of what we would expect to see based on who is more likely to report a victimization, and that is that they were mostly white female clients in Maine. And so when we were trying to look at that transgender category, out of 5,058 records, only 35 of them were marked as transgender. And even less than that, 99 were marked as an unknown gender and 2 were marked as other. So there's not a whole lot of that underserved LGBTQ or gender identity being reported on here. And that might just be that, like, there's not a good explanation except that there's 5 categories in the database for service providers to choose from. And what we often see with, at least with some of the federal reports that I work on, is that the gender categories might only say male and female on an intake form or an other, and you let the client decide how they want to report in that situation. And so that kind of, like, the level of detail that might get lost on just, like, even a federal form, it might just be what a service provider is used to, like, is used to providing as options to their clients.
One of the things that's interesting about the gender breakdown and where it sort of then intersects with this project is we have a really robust partnership with Maine Transnet, which is the largest and oldest trans-specific service provider in the country. And we do, like, trans-specific, we've recently launched trans-specific support groups for survivors of sexual violence that are co-facilitated between Maine Transnet and Sexual Assault Services. And so this 1%, the 35 number, since we have started doing this more specific service partnership, that's almost doubled. And so it's interesting to me looking at what I now see as old data, because, you know, it was from 2016-17, and I'm able to look back at this, like, old data and see the ways that it has improved because of service decisions that we've made, but that I would not necessarily be spending my time going back and, like, let's see what the data told us in 2016. So I love having this reflection back.
And so just a similar overview for the primary race breakdown. One of the other things that we identified with VOCA and talking to DESPI is that a lot of the demographic information for client records is either unknown or missing because a lot of the service providers provide hotline services. And it's not a service that lends to collecting personally identifying information like race demographics. It's not a question that is easily even broached over the phone because it's not a reason, And so when you have a service provider entering in a client contact, a lot of the demographic information might be unknown because that's a hotline service provider. And so it's expected. And it also means that there's that body of information that we don't know who's accessing the hotline calls, unfortunately, and that's the more comfortable way to even provide hotline services.
It's what we'd call, you know, just our cost of doing business. So we have ability to collect a lot of information, and we just simply don't for the helpline, and we're okay with that.
Yeah. And so, again, just looking at a quick breakdown of how many client records out of the 5,058, this is like a quick breakdown of what some of the other demographic numbers were that we could look into. And so they weren't huge numbers, which means, like, looking at statistical significance of differences in services is pretty difficult when you have a really small N for that one variable compared to the total client records. But that is, again, expected, especially when you have a lot of people reaching out on hotline calls. And then we also looked at service types, and so one of the interesting things that I was able to look at when looking at the top service sites or services received was like comparing this variable to the age of the client and to the gender or primary race of the client. And really the trend was almost identical for each variable, with very few exceptions, where the one-to-one support category and the systems advocacy category were always the top two. And so one of the things that we are able to come to with this finding was that, and would speak to one of our recommendations in our final report, is that the services are broad, the service categories available in Empower DRB are broad, and so this one-to-one support category captures the hotline services, but it would also include face-to-face contacts, counseling could be included in this category. And so to piece out those specific services is a little more tricky. And then there was also some really neat findings about how often a safe accompaniment was being received by different age categories or gender categories. I didn't include that more specific level of breakdowns here just because I, again, wasn't sure what kind of data people would be interested in seeing. But, and so one of the other things that we looked at was these other variables for where the service is received, the type of service, if the client received medical attention and it was known or reported on, if legal action was taken, if they reported to police. And so one of the major findings that we had for this is that they're not required answers in the database, because that's just not a route that is required of clients either. And so there's a lot of data that had either a missing response or an unknown response, and it made up large chunks of the data for some of these categories. And again, when so many people ask us the hotline call services in Maine, that's an expected finding, unfortunately, that you would need to ask them. You wouldn't ever ethically put that on a client to force them to answer some of these questions.
One of the things that we've done, I wish I had sort of kept a list of the things that I've changed about our system since we began this, because the process of handing your data to someone else to look at is really, I mean, it feels a little like undressing, and because you're showing off all the things that you missed potentially. You're showing all the ways it wasn't right, and it's fine. We have a good and trusting relationship, and so I was happy to do that. But I wish I had kept a list of all the things I fixed through the process of saying, here you go, and one of the things that we have fixed was in the unknown data, we accept that a lot of the data will be unknown, and we are okay with that. What we have changed in the database is that now the service providers must select unknown. They can't leave it blank. And so what that does for us is transitions from were you lazy and you gave up? Were you too busy and you didn't come back to it? Do you actually know and you just forgot? And instead, they have to make an intentional choice to tell me that they do not know the answer to the question. I'm fine with unknown. I'm not fine with you just didn't get there. So that kind of system change has been really helpful in helping us clean up our data. And so what we've collected in the interim, for the year starting now, is much better. We still have lots of unknowns, but we know more about the nature of the unknown.
And that's a major point to this collaboration too, is just even finding ways to improve data collection is a great finding. And the fact that there is like some streamlined variables for service providers in Maine to report on is rare for states to have, like to just have a list of definitions for what the service is and what the expectation is of when you select a certain referral type. So that level of streamlined for data like is really promising for being able to mine this data again in the future to see like what the trends are going forward. And then one of the other things that we were going to include in our final report, on top of like changing some including definitions that there already are definitions, but even like making them more less inclusive. So to like make service categories less broad and more specific, like Jesse said, they've already implemented changes to require a response of the service provider entering the data. Would be that as we know, like in the social services, there's a lot of turnover, and that can impact training and who's being trained, what material, or if they're being trained by a coworker, and the coworker's perception of how important the data isn't the same as Dusty's or mine.
You might imagine that my love and obsession with data does not necessarily carry all the way out to the end user.
And so we were talking with Dusty about like the frequency of like how often people or service providers are trained on like what's expected of them when they are entering a client record. And then we actually have already submitted another proposal to continue this project for looking at an underserved needs assessment that Jessie already had collected data for, and again hasn't had the internal like time to mine on her own. And we are hoping to hear back soon because we submitted it a couple weeks ago. I think it's been a couple weeks at this point. But that one would allow us to look into their underserved needs assessment for like providing them a template of how to mine it in the future if they were to do another, and to get another deep dive into what service providers are seeing for their underserved communities, especially considering the rural communities in Maine and how that variable is understood by service providers can vary. So people reporting on if their clients are in a rural town or not varies, like just between perception of what rural Maine is. I don't know if you have anything else to add.
I guess the only last thing I would say that has been an important improvement in our system since doing this that's just interesting to me is also as they were breaking things down, they would come back and say, hey, I see that in this county something's happening that is not reflected in this other county. What do you think is up with that? Well, usually what's up with it is a training issue, you know, or a utilization issue, not an actual like crime victimization issue. And so because we were not often, we typically report in the aggregate, we weren't often disaggregating the information, and so we were missing errors like that. And so now we've created all my program staff who have areas that they oversee, you know, like support group folks or whatever, within the coalition are running their own reports monthly, disaggregating by county, mostly so that they can catch errors in the service area that they would most understand, and then make an immediate call out to the folks serving in that county and say, hey, let's talk about what definitions you're using here. Or, you know, and most often what they say is like, I didn't even realize. I think that's so. All right. So that's, you know, another kind of cool, like, system correction that's been useful.
Yeah.
Thank you.
Thank you.